So what is the aim of the evaluation? To assess the stage of the liver disease, to assess the activity of the liver disease, and also to assess the viral status of that particular person. So that's why all the patients who have got incidentally detected, we should work up, follow up. What we should do? We should see the clinical course of the problem, jaundice, ascites, or any bleeding, whether they have got or not. You do the liver function test properly. You do an ultrasound to see the diameter of the portal vein ascites, nodularity of the liver. And you do fibroscan if possible, and nowadays everywhere it is possible to check the fibroscan. And sometimes you have to do the scan, CT scan, to see the liver. And also for further, biochemically we should check this group of patients with E antigen, with DNA, quantitative of course. You do an endoscopy to see whether varics are there or not, so that we should know chronicity of the problem. And in certain patients, probably we should go for the liver biopsy. The evidence of chronicity, how we will know? If there is ascites, splenomegaly, there is ultrasound, clear, picture they will show, is low albumin, or if there is hypersplenism, it means the chronic disease. But of course, from the liver biopsy, you can confirm, or for endoscopy also, you can confirm that there is varices, means chronic case. So coming back to our patient, what happened to that particular person? So on 5th of June, he consulted the family physician. Of course, the family was, as usual, very much concerned about. So they went to a family physician, and he was prescribed immediately Arsocol, B complex, and the Entecavir. Entecavir is the antiviral treatment for Hep B. So my question immediately, and all of you should ask yourself, is it justified to prescribe an antiviral to anybody if it is positive hepatitis B? It's a big question. All of us, we should ask ourselves before prescribing it. And he was very much confused because he went to the pharmacy and it is a very costly medicine. So he thought that, okay, let's have a second opinion. He came to me with gastro consultation. For the gastroenterologist, it is again coming as a dilemma. Why? Because to stop the Entecavir, the antiviral drug, or to continue the Entecavir. If I stop it, he will go back to the village or where from he came and ask that doctor, and some confrontation may be, it can happen. But the person himself, he did not started the medicine, so that's why it was easy for me. And I am describing here what we should do when somebody is coming to you with hepatitis B positive patient. If it is, you ask yourself what to do, and this is what we should do. You do a detailed examination, detailed history, advice for the family member. This is important because you ask the patient to check all the family members for Hep B. If it is positive, treatment has to be done. If it is negative, all the members should be immediately vaccinated so that it is not transmitted. You ask the patient not to donate blood in future because he is already has got the positive test. Then, of course, you do the proper counseling of the patient, what he should do, what he should not do in his whole life. And also the family members should know about it as a detailed counseling. This is the picture of a family. The parents as well as the two kids came to me from Arunachal Pradesh, and all of them are positive for hepatitis B. But very interestingly, the person, the father, he got the diagnosis almost 15 years back, Hep B positive. But unfortunately, the doctor who started the treatment for the person, he did not explain everything to the family. The family was not vaccinated at all, and subsequently, that's why whole family is suffering today with Hep B. You see this picture, this picture showing 10-member family. One of them came to me and subsequently I checked, whole family today, Two of them already died from Hep B cirrhosis. 3 of them on observation, and rest 5 they are on treatment for Hep B. Again, the similar picture. The concerned doctor, the first, did not told about the counseling, vaccination, and all these issues were not discussed. Even 2 cousin brother of the person who came to me also died from this particular Hep B.